what I discovered with CHF is that you can't address racial health disparities without addressing all racial disparities. I think probably the best trend, and it also can be the worst depending on how you look at it, is that the dialogue is getting a lot more sharper and a lot more focused. And I think it's due to the need for this country to finally have a conversation, an honest conversation on race. Maybe it's due to having an African American in the White House that has driven some of this, or just people's fatigue with the continuing gaps that exist in many different social forms, all looking as though they're based on racial lines. And there's a lot of fear in the conversations. There's some courage that I've seen as well, which is hopeful. But there's a lot of fear, a lot of anger with the declining economy, as people begin to want to blame other groups as to the cause of the economic decline in this country. But as we continue to talk about some of the things in this country desperately in need of fixing some real serious problems, race is one of those problems that seems to be in the top 3 or 4. And so the conversations, again, a lot more sharper. They're a lot more focused, a lot more crystallized, a lot more people having them. And to some who just don't want to have them, I think the conversation is a lot more painful.